Hi, my name is Patty Geraghty. I'm a nurse practitioner in women's health, and we are here tonight to talk about what mom couldn't tell you. Recent research, sex, and women. Now, for years I've given talks about women's health, and we would always get to the part about libido or the part about sexuality, and I would say, you know, there's absolutely no research, and that means that everybody gets to have their own theories. So the teaching learning people say one thing, and the hormone people say something else, and the sociologists say something else, like she's working all day and then she's taking care of a house, and excuse me? Somebody else wants something from her? I don't think so. However, since the turn of the century, the research has exploded. And so now we actually have some evidence that can help. The first thing we were taught was Masters and Johnson. Not quite right. They told us that women were running around with this, well, people were running around with this sort of arousal state all the time. And then we get intimate, we get a little excited, and if things are going right, we have an orgasm, and that's the end of it. So women would come to me and say, that arousal state, that interest, just not there. And they would think there's something wrong with them. Well, hello, Dr. Basson. We have a new model about women. It's a little more complicated. And instead of a nice little linear, things are spinning. We have our spontaneous sex drive. We have the way we feel about ourselves. We have our social roles. We have the biological and psychological things pitching in. And then maybe we can get a little bit aroused, and maybe we can get excited, and then we go back to thinking about ourselves, and it just keeps spinning around. And you can see why it takes a team to help someone be as healthy as she can sexuality. We're lucky to have a team here because we can deal with the emotional stuff, we can deal with the biological stuff, we can deal with the health and the nutrition and all of that put together. Now, as a women's health nurse practitioner, I want to talk about the women's health component of it. What else? It's a little bit more involved than just your estrogen and your testosterone. Yes, women have testosterone, and your progesterone. I like to call the estrogen, testosterone, progesterone as sort of the set managers. They design the stage and they keep the set in good shape. So we have what we call secondary sex characteristics. Women look like women and men look like men. But then we keep that stage healthy with the one part of your body you want, plump ladies, your vagina. A nice, stretchy, plump vagina, and moist, and all of our skin smooth and happy. And so women will also come to me and they'll say, will you measure my hormones? I don't think that there's something not right with my sexuality, my libido, my arousal, what have you. Well, sex hormone measurements are really unequal to sexual desire and sexual health because they're the stage managers. What's involved in all of the arousal and the interest is a lot more complicated, as you can see. So we have the serotonin. Serotonin kind of turns sex off. Where do we use serotonin medications? In depression. Antidepressants are famous for disrupting our sexual health. We have our dopamine and our norepinephrine. They turn it on. They're excitatory. We can also have some medications that we use in depression that are SNRIs. They can be helpful in sexual responses. Wellbutrin is the brand name of one of those. What else disrupts our sexual hormones? Cannabinoids. Oh, bummer. Okay, so the marijuanas, they may be arousal temporarily, but long-term use, they are hormone disruptors, we call. And then we have one that's in the sort of in the stage, off stage right now, melanocortin. That's an excitatory hormone. And we do have in phase 3 clinical trials right now a substance that stimulates the melanocortin that can be used on an as-needed basis. So when we look at the excitatory substances, the norepinephrine, we actually have a product available that is approved by the FDA. Its generic name is flibanserin, but medications always have two names. The other name is Adye. It's taken on a daily basis by women. It had the largest clinical trials of any medication ever approved by the FDA. Over 11,000 women. The outcome was it improved satisfactory sexual events by 1 per month. So the FDA was ready to say not good enough, and women said, hello, 1 per month is 100% better than 0 per month, okay? And so it did get approved. Now, flibanserin is taken on a daily basis. It works on the central cortex. That's why it works on the excitatory symptoms or system for having sex. It does have one problem, is it has an interaction with alcohol. So when women take this daily basis, they cannot drink alcohol. It's a little interesting. They did this study. Remember how many women I said were in the study? 11,000 women in various studies. In the studies, they didn't tell women they couldn't drink alcohol. But then when it came to the safety data gathering, for some reason, they took 26 young men. They had them fast for 12 hours, and then they had them do 4 shots of alcohol and a flibanserin. They had to contact emergency medical services. These young men were not in good shape. So it got a black box warning, we call that in pharmacology, a black box warning that it cannot be combined with alcohol. But it's a lot more complicated than that. The whole sexual response cycle, as we said, the social issues, the relationship issues, all of that. And another important thing is knowledge. I want to go back and talk about something else Mom couldn't tell you. We're familiar with the pictures of our female anatomy, and we know the names of the outer labia, the inner labia, the vaginal opening, and then we have this tiny little clitoris at the top. I actually went back and I looked at my anatomy textbooks from graduate school, which was a long time ago. And in fact, just as you see right now, that was the picture of the anatomy that we had, the little tiny clitoris. Wrong. That's the smallest part of the clitoris. The clitoral tissue actually goes up in a shaft, and there are 2 lobes that go down along either side of the labia. And in fact, that tissue is excitatory, responsive tissue that is slightly less sensitive than the clitoral head. So for a woman who's not fully aroused, maybe even not sure she wants to be fully aroused, touching the clitoral head can fire off pain neurons. It can feel uncomfortable. But touching the other excitatory tissue can help with arousal. That's a knowledge thing. Do you want to know something interesting? I have this wonderful 1842 textbook of obstetric and gynecology. It was too precious to bring in tonight because it's not holding up very well. But I went in the lovely woodcut illustrations of it to see what they thought a clitoris looked like in 1842. They got it right. They had the lobes, they had the shaft. So what happened between 1842 and that not to be disclosed year that I went to graduate school? All I can figure is Queen Victoria. So what else do we have that can help women with understanding sexuality and the stage set? Talking about wanting to be plump in the vagina. The vaginal tissue is very similar to the tissue that's inside this cheek. Squamous epithelial tissue. But unlike inside the mouth, the vaginal tissue is very dependent upon estrogen to stay plump and elastic and moist. There are many stages in life where women's estrogen can take a hit. One of them is after she has a baby and if she's breastfeeding. That's a natural low estrogen state. And many young mothers, new mothers, will have issues around vaginal dryness and pain with intercourse. And then the other really obvious life stage is menopause, after her ovaries stop producing so much estrogen. There can be dryness, there can be pain with intercourse, and since the whole sexual response cycle is very complex, pain is not, you can be thinking, I can ignore this pain, I can get past this because the relationship is good and I want to be intimate, but the brain is smart, and the brain keeps remembering this hurts, and that can take a real attack on libido. So there are a number of things that you can do in both of those stages of life. One of them is local topical estrogen. That means an estrogen cream, an estrogen ring, there's an estrogen tablet that is delivering the estrogen to that area, and it's creating an estrogen-rich environment. Once again, information becomes important. It's not immediate. Estrogen is not a lubricant, it's not a moisturizer. We're always building new cells. So as old cells are dying and new ones are being formed, in this case, the new ones are being formed in an estrogen-rich environment. So I can actually make a slide when I see a woman in the office, and I can look at this tissue of just some of the cells from the vaginal wall, and I can see if it's estrogen-rich or not. I can provide her with local estrogen, have her come back after she's had time to grow a new vagina, and it takes about 3 months. That's an important piece of information to understand. Cell by cell by cell being replaced. I can look at that slide and see a very different quality to the cells, that they are now estrogen rich. So sometimes I'll have women tell me, oh, I tried that and it didn't work. And the first question I'll ask is, how long did you try it? Because it's only at 3 months that you begin to see symptoms improve. For women who perhaps are not as severe as symptoms, daily moisturizers. We moisturize other parts of our body. It's okay to moisturize the vagina. And lubricants for intimacy. Now, not any lubricant is going to work. It needs to be one that's designed for sex. And in my dreams, they would say that on the package, but they don't. So you have to sort of hunt and look for them. And the typical code word is intimacy. And then finally, another method that can be used to improve the health of the vaginal wall is laser therapy. I gotta say, I am so glad I was not in the room when whoever thought that one up thought it up, okay? Okay. But this is FDA approved. Now, lasers, it's all about physics. It's all about amplitude, frequency, duration. And that's why I can have a laser that'll point to a slide when I'm giving a talk. And the local academic medical center can have a laser that will go in and cut out the middle part of a brain to fix a tumor or something without damaging the rest of the brain. Those are both lasers. And some lasers, as you probably are well aware, can remove hair, and some can remove brown spots, and some can remove red spots. Well, the CO2 fractional laser, whose brand name is Mona Lisa Touch, it's Italian, Mona Lisa Touch laser calls to collagen and water. So it taps in your body's ability to heal itself. It delivers a tiny microarray of micro wounds that then as the body heals, we have healthier cells. And I can do the same thing in this situation that I do with the topical estrogen. I can make a before slide, I can make an after slide, I can see it healing. But what's the most important thing? She can tell me that it's feeling better. She can tell me that it's healing. So when women come in to me with these concerns, let's say she's coming in around Christmas time, I always have to tell her, this might not be ready in time to be a Christmas present for you or for your partner. But get started now, and it's going to make a pretty decent Valentine's Day gift. Thank you for joining me tonight. I hope that I could share some information that'll help you be healthier in all aspects of your life.